Everything we discuss is out in the public on the website afterwards, but we talk every day, and the issue that came up yesterday was the fact from some of the outlying leaders is that they were seeing gatherings of people without any kind of face coverings in close proximity. Our issue is that as we opened and reopened with phase one this past week on Friday, our numbers were very, very close because we had really two surges with infections and hospitalizations in both Monroe and Ontario County. So the thought is if infections go up, if people don't really adhere to the practices that we have reinforced going back several weeks, we do not want to see a spike in infection where the openings we're having now get slowed down and the upcoming phases get slowed down. It's all going to be predicated upon the public health data. So that really was, in essence, what we did last night. You'll see a lot more of that, of us trying just to reinforce, please, if you can't stay 6 feet apart, wear a mask. Follow the principles of the hand washing, the distancing, the face coverings. If you can't stay more than 6 feet apart, and disinfecting, those four things at a minimum will keep this infection rate from going up.
I have our first question from Tanner at Channel 13.
Hi, Bob. My question is about actually the recent increase in hospitalizations and cases. I was wondering, I saw Dr. Mendoza tweet over the weekend that part of this could be due to the state's order to keep COVID-19 residents from nursing homes and assisted living facilities at hospitals, or requiring them rather to be hospitalized instead of go back to their facility. Is this resulting in an increase in the latest increase in numbers that we're seeing?
I would sense the latest increase we've seen probably is the increased testing that's going on right now. The entire region, really every region across the state, is testing more. And while the two spikes appear to be in nursing homes, which several resulted in hospitalizations, I do believe it came from that particular issue of just this constant testing. And both our two hospital systems, WROC and Rochester Regional, have been fantastic. The nursing homes are all trying. We're actually in the process now of asking for more resources, more reagents, more swabs, just because of the need to keep on testing. And that said, with the increased testing, we're going to see more cases. It's going to happen. It's a natural result of that. But the concern we had, and what we're going to really keep reinforcing, is it's not any time to just throw up your hands and say, well, we're back to normal. Let's go out and party, have picnics, get together, and don't wear masks, stay in close proximity, forget about this. That's our biggest worry, because the governor has been very serious about his position. If the rates go up, the reopening is going to slow down. And the control room's responsibility is to monitor that and report that back to the governor's team. And that was a concern that came up yesterday, and something that I think we can't reinforce enough, that we're too close right now to take a step backwards, and the virus is not going away. It's going to be here. And, for all the people that the other side of this issue that talk about this freedom issue, I'm sorry, it's a responsibility issue. It's protecting yourselves and your family. That's what we're asking for. Just if we all do our own role, which I think we've done pretty well so far throughout this whole pandemic, let's just not stop now and keep going. There are businesses that want to reopen. They want to get to phase 2, phase 3, phase 4. If these rates keep going up, it's going to be a very, very slow process getting there. So that was the whole point of what we're putting out on social media and what you'll see continuously from us.
Okay, Wendy Wright has the next question, followed by Berkeley Breen. Go ahead, Wendy.
Yes, hi there. Good to see you.
Hi, Wendy.
I have a question just in regards to how, it might be a police thing, but how are you going to recommend enforcement of this? Because as we approach holiday weekend, and as it gets nicer, not counting today, but as it gets nicer out there, it seems like we may be seeing more and more of this.
That's a great question. And in the long run, we don't want to have enforcement. We want people just to use voluntary compliance, be respectful of themselves, their families, their neighbors, and do this. And I get the warm weather. Listen, we've gone through the last 2+ months. A lot of us, no haircuts, haven't gone to the gym. We don't go to the stores. We don't do things we're normally used to doing. People that have had their businesses shut down, they're not working. There is stress and anxiety everywhere. We get that. And people are tired. People are tired and really fatigued with this. But we're too close to stop now. And so there will be enforcement, and enforcement is at the lowest level. Could be a village, town, city, county official able to do that. The state enforcement that could be from the Department of Labor in certain cases or complaints, or the State Liquor Authority, which we saw out toward Buffalo and Lockport. The SLA did shut down a bar for violating the closure rules. I'm just saying it's not worth it. Don't add to anyone's pain. We don't want to see that happen. We understand the loss that people have felt so far. I think I can speak for the governor. He does not want enforcement either, nor do all our county officials. We just want people to really listen to the guidelines and follow them. And the feedback we had in our discussion yesterday, it's not just Rochester, Monroe County. Some of your outlying counties, people are seeing these gatherings come together. No one's wearing a mask. They're close. It's like it's party time again. And I know Memorial Day weekend's coming up. It's a time for picnics and things like that. I think we've had a very different year so far. It'll be a very different year throughout the rest of it, I'm sure. But we have to get through it. We don't want to take a step backwards. So we're just asking for voluntary compliance. People have called, emailed, they see shops open. We pass that along. We just hope that people would adhere to it and not get into trouble, not lose any more, not be fined. I think a perfect example was a pizza owner that made a comment publicly. He was going to open up. Great pizza shop, I might add. He was open, but he wanted to open up for dining. And I believe a town official just wanted to visit and said, don't do it. Here's what could happen. And he didn't. And I think that's the perfect way to handle it. Not arresting somebody, not enforcing it, causing a fine. We've lost too much already. Just reinforce to people common sense. It's not about an issue of freedom. It's really about responsibility for all of us. I don't want to infect my family, my neighbors. I don't want them to infect me. And I'll tell you, you get a really visceral reaction when people see somebody coming toward them now without a mask or without some kind of face covering. So I think there's really both sides of this issue. But I've said it so many times. We're rounding third base. We have to keep going. There's going to be a vaccine at some point. We just don't want these rates to go up.
A reminder, if you have a question, please let me know in the chat function, and I'll call you in the order received. Up next, we have Berkeley Brain.
Thank you, Dan, and hi, Bob. Bob, if you look at Dr. Mendoza's tweet, his 6th out of 8 tweets, he says if this trend continues with increased hospitalizations with longer stays, it potentially threatens our region's performance on the hospitalization capacity reopening metrics. In other words, this could have an impact on whether our community stays open. How concerned are you about that?
I'm very concerned, and Dr. Mendoza is spot on with that. The spike we had last week, we were all worried that it might have delayed the opening of phase 1. We were up, almost nudging the numbers. The governor was great. We reopened. We got off with construction and manufacturing. The light retail changes, off to a good start. But these reinfections and spiking of hospitalization and infections, that's real. The governor set a mark. 30% of hospital beds have to remain open. And so we had several hospitalizations the last couple of weeks. We still have capacity, and our hospital systems are absolutely great. But if these trends continue, it's going to really slow down dramatically our whole reopening process. Yeah, the governor announced today, Buffalo is reopening. They hit their final 1 or 2 metrics. But for people listening, this is not about protesting. I'm not going to wear a mask, or this is all about me. I refuse to do it. Berkeley, in all honesty, I hate wearing a mask. Is it comfortable? No. Do I love putting it on? No. Why do I wear it when I'm out? Because it's my responsibility to do that. I don't want to infect you, your family, or me, or somebody else. It's a simple thing to do. And the rules are, if you cannot keep more than 6 feet away. So it's not if you wear it 24/7, but if you can't keep that distance, then you should have a face covering of some sort. So we want to remind people that it's no time to forget the rules, step back, or maybe purposely try to circumvent the rules or guidelines, because that will only cause us pain. Next up, the governor mentioned hair salons, barbershops. We have had hundreds of emails, calls, requests in that area. Think of the economic impact, all those shops across this 9-county region. If these numbers go up and we can't get them reopened, think of how they're going to feel and the people that work there. So I think it's a collective responsibility on our part just to hang with it. If you can't keep that distance, wear those. But Dr. Mendoza has been our own Dr. Fauci here. He's been on point. He's all about the data. I'm on a call with with Dr. Mendoza every day. He has been just a great resource for us. And I can't reinforce enough what he said. We want to get to phase 2, phase 3, and phase 4, and not have them put off indefinitely because of spiking infections.
Again, if you have a follow-up, if you've already asked a question, let me know. We'll get to you when we get through the first round. We have until about 2 o'clock. Up next, we have Patty Singer. Patty, go ahead.
Hey, Bob. So I've asked this question just about every opportunity. Where is the mental health representative at the table in the control room guiding this reopening? You just told us that everybody is stressed and anxious. What is being done? Who is the mental health voice guiding every step along the way, just like Mike is for physical health? Who and how is it being done for mental health?
Well, both hospital systems are represented there. The issue of the control room is just to monitor the numbers. The control room does not have authority to make decisions, but we fully support the issue of mental health. I've mentioned it several times. I've talked to groups and webinars, and the governor has just put out again the mental health line for people to call. We understand the pain, the anxiety, the loss that people have had. It's a real issue. I defer to both hospital systems who are there, who have the capacity to make those decisions on point. But those issues don't come up to us directly at the control room right now. It really is, it's the constant monitoring of the numbers. It's the infection rates, it's the hospitalization rates. But nobody's turning their back on the issue of mental health. I think I can speak for both systems and the state. A real issue. The resources are there. I think even the county has resources attached to this as well. So I think a lot of people are monitoring that. And concern I would have, Patty, during these times, if somebody really has some urgent need for mental health counseling, I'm assuming it's going to happen like we're doing it right now, remotely via Zoom as opposed to in person.
Up next, we have Rebecca Fath, and then we'll get to follow-ups. Rebecca, go ahead.
Hi, how are you?
Hi, Rebecca, how are you?
Good, thank you. So my first question is about parents. I always ask about parents. But so, you know, we're hearing and seeing from some parents that they're sort of almost being pressured into letting their children participate in like groups with several children. And some parents are very uncomfortable with it. Then they have to deal with their child being like, why can my friend Billy play, but I can't? For parents, what would your advice be to them? I mean, is it okay for their kids to play with other kids, or is that just not a good idea right now?
I think the issue of playing, I go back and apply the same principles the governor's put out. If you cannot keep more than 6 feet away, you should have a face covering. And children can not only contract the virus, as you've seen with some of the horror stories of young kids that either have the virus or a form of Kawasaki disease, as well as transmit to somebody else. So I think parents that disregard that are not being responsible. And I get it with kids. You know, I have a very young grandson, but I can imagine I go back in my days, it's hard to tell kids they can't play. Yeah, it's hard to tell adults they can't go out and run and gather and play sports. And we, you know, we're all going through it. We get it. But if that's going to happen, to be responsible and to, you know, again, for kids, I would say the same thing, a face covering with those children. If they can't, they're playing in close proximity. And you know, step by step, the state is trying to take in everything into consideration. But for those who protest and are arguing, I give the governor a lot of credit. This is not an easy situation to be in. He has a tremendous team behind him with all the analytics. He's trying to do it safely. He's trying to get things going. There's a lot of momentum building right now at the state. A lot of things are starting to open. There are regulations updated almost daily. But we just don't want to take a step backwards now. And adults can transmit the virus just like children can. And there's too much to risk. So if you can't keep that proximity of 6 feet or more, simple step is just have that face covering.
Thank you. We've got about 10 minutes left. We're going to go to Wendy Wright for the first follow-up.
Yes,
go ahead,
hi.
Wendy.
So I'm wondering, can you hear me? Yeah.
I can, yes. Sorry for the,
I'm wondering
our internet went down on the desktop, so I'm working off my phone.
Oh, okay. Okay, there is a billboard on 390 right now. It's called, it says flatten the curves with arrows pointing up that to unemployment, bankruptcy, and suicide, as those saying those curves are going up. And there is, and you brought up the freedom comment earlier that people are saying on the opening, push for the opening side, that their constitutional rights are being violated and they should be able to open at phase 4 right now.
Well, I would say this. Somebody sent me a picture of that this morning, the poster on 390. I get the issue of, again, mental health issue and suicide and unemployment and job loss and economic loss. I get that. And it's balanced by a loss of life. And you look at some of the stories. I know a former state senator, I don't know how many weeks he was in a coma, coming out, the deaths, the hospitalizations. It's a public health crisis. I mean, it really is. And listen, the constitutional freedoms, I'll give an example. If our police chief has a shooting tonight on a street in our city and somebody's firing out a window and you and I want to go down that street to our house, we're not going to be able to do that. So our freedoms are restricted right then. Why? Because our public health and our safety would be at risk. And the chief would be absolutely right to stop people going down that street. We stop at a red light every day. It restricts our freedom for 2 or 3 minutes. We can choose to drive through it, but the outcome wouldn't be a very good one. So in this particular case, we're asking this for a common sense approach. And, you know, I think this takes on, I would say this, very interesting political overtones as well on this. And let me be very clear on this. Our governor is opening the reddest parts of New York State while keeping the bluest parts of New York State closed. So I would say emphatically, there's no politics involved with his decisions. He's actually opening upstate first and giving upstate a chance to do this. And I'm proud of the Finger Lakes is one of the first ones that was opened. We want to keep opening, but don't want to stop. And people can protest all they want. I could care less what they protest about. All I care about is getting this region and our state open safely, people getting their businesses back to normal, and doing it without contracting this virus, losing their health, or God forbid, their lives. That's our number one goal, to get back on track. And I've been through enough protests in my life. God bless them. It's their freedom to do that. Do it. The governor has a responsibility to do this safely. I think he's doing an extraordinary job.
Try to get through the rest of the follow-ups in the 7 minutes we have left. We'll go back to Tanner.
Hi, back to the spike in hospitalizations that we've seen the last few days. Is a part of that possibly due to accepting nursing home residents and assisted living residents from outlying counties? Has that been happening? Or I guess I know, you know, the numbers only speak for Monroe County, but I'm not sure if there's any outside residents that you know of coming into Monroe County hospitals, and that is maybe why we're seeing this increase.
Tanner, I'm not aware of that at all. I'm aware that there were a couple of concentrations in those spikes in nursing homes. And what happens and I'd say nursing homes, it could be assisted living, but when you live in close proximity, one person gets it, probably does spread like wildfire. And I do know there's a couple areas. I know Ontario County had one particular spike, in that there were a couple of hospitalizations in both, to my knowledge, no fatalities at all, but hospitalizations on that. And I do think a lot of it is just the increased testing. You know, on one hand, the more we test, the more we'll uncover. And even those who are asymptomatic, who get tested, you may be carrying the virus and not even know it. So I think there are probably different levels of that virus impacting those residents and people, but the infection rate went up, and this seemed we're doing great. We were all green, and all of a sudden we started easing up. We stayed green, and it was right to have us reopen, but it was getting painfully close to the limit. And that really sparked even the comments yesterday on social media and today about just taking a step back. Let's not ruin this now. We're getting so close to reopening, and it's no time to just throw our hands up in the air and say it's over. It's not over. And everywhere you see it, you see it, you know, in New York City and other places, people are just very anxious to get out. And to go back, while there's a fear that people have, I have not heard of any case where somebody coming from New York City or someplace else up here was a source of infection. I have no knowledge whatsoever about that.
Go over to Berkeley Breen for a follow-up. Go ahead, Berkeley.
Here we go. Sorry, had myself muted. Apologize. Bob, little track this way. Summer camps in the region in Monroe County. What phase are they in, and how are they going to work, do you think?
Well, it's a great question. We have received countless letters and plans for that. I can't speak to what phase they will be in. My sense is probably a later phase. It's not so much about the type of activity, whether it be church, camps, gatherings. It's the gathering itself. It's bringing large numbers of people together in close proximity. So I've seen a lot of phenomenal opening plans for these camps. I know it's a big part of people's lives and livelihoods. I sense there'll be a ruling at some point. It has not come out yet. I don't expect it to be obviously in phase 2, but I think it'll come in one of the later phases. And I'll defer to the governor to make that announcement. But from downstate and upstate, the plans that I've seen so far, very thoughtful, very comprehensive. I do sense there will be an opening at some point. I just can't speak to when that would happen.
Patty Singer has the next follow-up.
I am back to beating that mental health horse. So what you're saying, Bob, is that there's no one with you in this inner circle of people that is advising strictly on mental health. You're just leaving it to the health systems to determine this. There's no equal seat at the table for mental health at this most crucial time.
Hey, I think you misunderstood my answer before.
Okay.
This control room is not strategizing. That's done at many different levels and different entities. We are just simply there to monitor the spike of infections around the region and then make recommendations on that. Make no mistake, both hospital systems and really around the 9-county region, there are mental health professionals hard at work. The governor just announced 24-hour hotline for mental health. He just announced that last week. So don't anyway interpret that there's not somebody at the table. This table is not about strategy. It's not about the next steps. It really is monitoring the numbers. The strategies will go down to, from a state level down to the county level, as the governor's team comes out with their reopening suggestions and their rules and regulations for those. They'll be very, very clear, very comprehensive. But the control room, clearly, it's like monitoring temperatures in a boiler room. We are there, 9 counties, trying to stay on top of the hospitalization rate and infection rate. That's what we're charged to do. We are not charged to offer strategies. We're not charged to make recommendations. There is a huge amount of room and opportunity for mental health professionals. And I would say right now, they're probably very actively involved with both hospital systems, with the counties, and with the state. But just I want to be clear about the function of this room is not making the recommendations on strategy. It's not making sure everybody's represented. It's clearly one person from each of the 9 counties, myself, the 2 hospital systems, there, our county health director, there's 2 health directors, a Monroe County health director, and another representative from the other 8 counties. And so with the spikes, they go back, they make recommendations, clearly back to their own respective areas, but our role clearly is those rates: infection, hospitalization, intubation rates.
And final question in the few minutes we have left, Rebecca Fath.
Hi, yeah, thank you. So another quick pivot here. How many Rochester companies are still hiring, and how the hiring process has changed? Can you chime in on that for me, please?
That's a great question. I can't see any trends right now. We're just starting to reopen, so I would say clearly construction and manufacturing would be 2. We've had a lot of essential manufacturing up and running already, but what they call it non-essential starting to ramp up. I think the big question is, and I don't have the answer, is the economic outlook going out for the next 18 months to 2 years. There are some horror stories building about where it's going to go. A concern that a lot of people have is when the PPE money runs out and the requirements for maintaining a workforce, they are exhausted. Will there be layoffs and job cuts? Will businesses that have been closed for a long time just not be able to reopen? And I do think for some, we may have hit the tipping point where they just cannot go any longer without revenue coming in. We're still waiting for, think of salons and restaurants, and spas and gyms. These aren't high margin businesses. These are, they really need to be busy almost every day. They've gone over 2 months with no revenue whatsoever. So those questions are unanswered. I don't even want to guess. I can hope for the best. We have a temporary staffing business here at our chamber. They've been pretty busy as of late, but for the longest time, there was nothing going on. So there might be some slight trends going up. It remains to be seen. But if I could comment on the other side of this, the key issue is going to be the consumer and customers. What is their confidence rate? Will they walk into a restaurant, a bar, a gym, a business? Will they get on an airplane? Well, even now, people are afraid sometimes to buy certain kinds of food for stories they hear. So I think we have to manage fear. And going back to the Patty Singer's question, I think the issue of mental health, fear coming up is a real one. And that may take a while. That a business may be open, but still may not see people rushing through the door when it does open. So it's hard to predict that right now, but I do think that's going to be something we really have to manage more effectively in the future as more entities reopen.
Thank you so
All right,
much,
thank you, Bob. Thank you, Bob, and thanks everyone for joining in.
Thanks, guys. Thank you. Bye-bye.
Bye.